Hello and welcome to Living Strong, the flip side of adversity. I am Dr. Virdra Jackson, the CEO and creative behind Living Strong Consulting. And one of the key pillars for living abundant that Living Strong was founded on is relationships. And the second is mental health and wellness. And this is an opportunity. The entire month of December, our focus is on how we can utilize healthy relationships to allow us to also be in a healthy mental place. And I think I asked our guest for this episode to be first because what we talked about in preparation for this episode is that your relationship with yourself is the foundation for all of the other relationships that you encounter. And the beauty of our conversation is one in which it's an opportunity for access, for healing, for a journey of greater awareness and presence. And it's cutting edge technology that I have been intrigued to know more about. So, let me introduce you to our guest for this episode. Dr. Benjamin Alouf is a board certified pediatrician and the chief medical officer at Limbix. Dr. Alouf has over 2 decades of experience in oversight and execution of clinical programs and policies, both in direct patient care as well as in the managed care environment. He has held leadership positions in large hospital organizations and held plans bringing together varied internal and external stakeholders in order to lead change and improve value in healthcare delivery. He has held faculty positions at prominent academic institutions and completed a Master of Business Administration in Healthcare Management. Before joining Limbix, he served as the Chief Medical Officer at Aetna Better Health of Pennsylvania. And I'm excited to jump into this conversation on really beginning to unpack the mental health journey for adolescents through digital therapeutics. Welcome to the show, Dr. Alouf.
Thank you very much. I'm excited to be here. I'm excited to kick off this month. It's a great topic, great discussion. I love your show. I listen to your episodes. I love the diversity and variety of guests and topics, from entrepreneurship to mental health to physical health. And I love the fact that you put it all together and really show how the different parts do fit like a puzzle to create a very dynamic and wonderful picture for an individual.
Yes.
So thank you.
Oh, thank you for that feedback. I appreciate it. Sometimes when you put things together, you never know how it's translated.
Right.
So I appreciate that. This topic I've been excited about all week and have already been receiving inboxes and messages. And so it is an important topic because so many youth are struggling. Before the pandemic, but even more since the pandemic. And I want to really jump right into the meat of the conversation. And one of the first questions is, why is reconciliation, reconnection, and support important for a healthy internal mental state?
The reason for that is, and especially what I see in youth, is that they have certain behaviors or certain feelings and they can't identify or reconcile why they're having these feelings. They can't voice it. They can't categorize them. An adolescent, they're very concrete thinkers. They're not abstract thinkers. And unless they have somebody who can help guide them through that thought process and explain to them how certain behaviors they're engaging in are affecting their mood, and conversely how their mood may be affecting their behavior, they really can bring that to light, and they think maybe there's something wrong with them. Maybe they're, a lot of kids are suffering from certain mental health conditions and they are not doing well in school.
Mm-hmm.
And so they're being put in the back of the class, or they're being excluded from certain activities, when indeed identifying that they have a mental health condition that requires help and support is not appropriately identified. And that's what we see. And as you mentioned, before the pandemic, we had an issue. The pandemic has really, kind of unroofed the situation and has made things much worse. We know that mental health conditions have increased by 50%. We know that visits to emergency rooms for suicidal attempts and even suicidal ideation have increased dramatically. We know that suicide is the second leading cause of death in adolescents. And so it's really become a national emergency. And that's not just my words, it's the words of the American Academy of Pediatrics. It's our Surgeon General has made an advisory statement to that effect. They're really in a crisis situation. We kind of took a population and a generation of children, and we said, you need to stop being in front of your screen. You need to stop being on your phone. You need to be out and socializing. And then in one fell swoop, we locked them up in their rooms and said, don't leave your room. You need to be in front of your screen. You can't be with your friend. And, we're pack animals. We need each other. And we took that away. And without that interconnectivity with other kids and with adults in their life that can identify certain behaviors and say, hey, maybe this is depression.
Mm-hmm.
Maybe this is anxiety. We've really come to this situation today.
And so that internal connection, them being able to recognize for themselves what the internal sensations are telling them, what the internal narrative might be telling them. It's important for them to be able to make those connections for themselves. And am I also hearing how external connections are also vital to that equation?
Correct. So yes, definitely the internal connections, identifying in themselves, but they don't have the tools to do that.
Mm-hmm.
They don't have somebody who has been through it or has experienced something to that effect or is trained to identify these things. Explaining to them what you're doing or the way you're behaving may indicate that you have depression, anxiety, or some other condition, and here's how you can be helped. It's what is wrong with me?
Right.
So. And then externally, yeah. So just in April, the Centers for Disease Control published a study, exposing, for lack of a better word, the increase in the mental health conditions amongst children. And one of the things that they did identify is that children who had connectedness with school or with others, even virtually, because this was done during the pandemic, had lower rates of depression and feelings of sadness and hopelessness, and decreased sense of suicidal ideation or even suicide attempts. And so that is why it is so important. Again, the pandemic, we removed them from those opportunities. And it's really incumbent upon us to help guide them back into it.
Mm-hmm.
And it's not so simple as the literal and figurative lifting of the mask and sending them back to school. What's actually being identified, and if there are teachers out there, I'm sure they're experiencing it. And you're obviously an educator, so I'm sure you're seeing it as well. That it's not so easy as, we'll all send them back to school and everything will be great. Well, some of these kids miss, a quarter of their life.
Yes.
2 years is a long time when you're 6 or 8.
Mm-hmm.
2 years of your high school, that's half of your high school. They're not coming back and everything is hunky-dory and it's as if nothing happened. A lot of them having, again, I'm sure you know this already, and you're seeing it and experiencing it yourself in your profession, but they're really having a difficult time adjusting.
Yes. So tell us about digital therapeutics and how do they work and what type of potential impact can they have on the needs that young people have?
So digital therapeutics, unlike wellness or health apps, are actually software as a medical device is the technical term, and it is providing therapy through digital means. And what separates them again from wellness or other health apps is they actually have to pass through a regulatory agency in order to be able to market themselves. And in order for them to specifically state that they either treat, prevent, or mitigate or manage a specific condition. And in our country, the agency is FDA, and it's actually becomes an FDA regulated product. And there are a handful of products out right now to manage attention deficit. SparkRx is for we are producing that product for depression. There are products for substance use disorder, and what it does is it gives you from SparkRx perspective, it's what a therapist would provide for you in face-to-face therapy, cognitive behavioral therapy, or the behavioral activation component of cognitive behavioral therapy, which is what works in adolescence. It's the most commonly used psychotherapy is cognitive behavioral therapy. Again, because they're concrete thinkers. So it goes over what we call the TRACK model, trigger response avoidance pattern, identifying that there are certain triggers, and then you then engage in certain behaviors that are avoidant and cycles back to worsening your mood. And tries to create coping mechanisms so that trap becomes track, TRA, so trigger response and alternate coping mechanisms. And there's gamification and so forth. And the nice thing about it is that it's not intended to be used without a therapist or without a provider. It's meant to be adjunct, as we say, therapy. But in a lot of respects, it allows the teen to work independently and autonomously and on their own time and in their own comfort zone, so that they may not be comfortable expressing or talking to an adult. A lot of teens don't like talking to an adult about their problems. So it allows them to create, there's a relational agent, a little what we call a Limbot that kind of walks them through. You move tiles around to identify how some of the events that you may have experienced resulted in certain behaviors that were, created a non-adaptive pattern. And then it shows them how to engage in activities and has them scheduling activities that will benefit and will help their mood. And we're very cognizant of screen time. And we hear a lot about social media causing mental, and we can get into that maybe, right? That's a whole other talk. But the goal is really for the teen to use it for about 3 or 5 minutes a day, to learn, to take a lesson from it, and then to go out into the world and engage in the activities. So they identify, behaviors that improve their mood based on either a value system or things that they prefer to do. And then it says, okay, now we know, pick an activity that's of value to you, spending time with your family. Let's talk about how you're going to do that, and let's walk step by step. Now, to those who are not depressed, that may come intuitively. Oh, I know what I got to do if I want to hang out and have dinner, with my family. But if you're depressed and if you're a teen and you're struggling with this and you're not quite sure, this helps and guides you through it.
So it sounds like there is a component that really customizes it to the teen, and it allows them to begin to recognize when there's either a thought or a sensation that I'm heading in the wrong direction, and it gives them an opportunity to make a different choice. Can you tell me, what do you hope parents begin to understand about digital therapeutics?
I think the first thing we do, and a lot of this is education, and it's not just parents and kids, it's also doctors, providers, and even legislators, is that, they're not wellness or health apps. They're not kind of off-the-shelf products. These are products that are FDA regulated. They have to show efficacy and safety in order to get that, stamp of approval. They are, sort of a point solution. They will direct treatment to a specific diagnosis. It's something that would be great for patients. Patients always ask, or the parents ask, can I see what my kid is doing in the app? The answer is no, they don't see it. But we also provide patient materials and education and parent materials and education because, you need that outside influence and support, and the parent is part of that treatment, or the caregiver in the household is part of that treatment paradigm. So we let the teen work within the app on their own, but we also, and also we want the provider to work with the parent and the teen, through that therapy. And through that support, and to know that it really is a different modality than some of the other products that may not necessarily be regulated. They're not. They don't have to follow strict HIPAA guidelines and sort of Patient Protection Act in terms of information sharing and things like that. So if you're digital therapeutics, you have to follow all those government regulations in order to be on the market as a product.
So how can an adolescent or a family gain access to Sparks RX?
So one of the ways to do it, so because it is because it's a product that needs to be given through a provider, the provider may already be aware of it. We have about 160 or 70 providers that are signed up for it. We've had about 600 kids already on it since last year when we launched it. They can go to SparkRx, SPARKRX.com. They can read about it, and they can also bring materials to their provider and say, hey, are you familiar with this? And then what the provider does is they sign up with us. They get an access code. The provider gets an access code. And then when they see a teen with depression, they can have the teen download the app, and they give the teen the access code that's unique to that provider. And then the provider can actually get information from the app about how the patient's doing clinically, and as well as how much the patient is engaging with the app. Because obviously if you're not using it, it's not going to work.
It can't help you.
Yeah. But the beauty of it is, and having been a practicing clinician, and when I pitch this to clinicians, I don't know if they're psychologists or pediatricians or other mental health providers out there, is, when was the last time you diagnosed a patient in your office, you offered them a therapy that they started using right there in your office, and then when they went home, you could actually monitor whether they're using it, how they're using it, and how they're responding to it. And not only that, if you're a provider, you can download it yourself and play with it, and you can see how it works. So, when I used to see patients, I'd write a prescription. I didn't know what happened.
Right.
And I didn't use most of the things that I would prescribe a patient. So if they said, hey, I'm feeling this, or okay, I'm not taking that medication, I can read what the insert says. But so it's really, and this is where digital therapeutics are headed, and, in that direction. And it's really a unique opportunity for patients to benefit from something that, we haven't seen until just a few years ago.
And it's really powerful for me that you started off by including, although the parents can't necessarily see what the adolescent is doing in the app, there's an element that helps them understand how SparksRx actually works and is working. And they can actually look for whether or not the adolescent is getting up and doing the elements. You're helping the young person become more aware about themselves, and then continuing to loop in community by connecting the physician to it as well for future feedback, follow-up, all of that. So it's really a comprehensive approach. We talked about we were at an event together, and we started a conversation around recognizing that in the pandemic, being an educator who sits on the board of Black Women's Educational Alliance, I'm often called into communities that are marginalized, that have reduced access to care, and actually have a low trust level of healthcare systems. How would you say use the access to digital therapeutics could impact or support marginalized communities?
So, it's interesting that you mentioned that. We do get questions from school districts who
Mm-hmm.
want to use it. Right now, SparkRx, it's not FDA cleared. We're running a clinical trial right now, and we'll be submitting the data to the FDA to get it cleared. We're operating right now under, this is very technical, but the enforcement policy of the FDA that allows you to commercialize digital products that treat psychiatric conditions during the public health emergency. But a lot of people, so we're able to commercialize it prior to clearance, and so we are. A lot of schools are coming to us. A lot of community health centers are coming to us because it's simple to use. You don't need broadband access, so it's something that a teen, unless the once a week, what we call the check-in,
Mm-hmm.
where they document their symptoms on a
Mm-hmm.
weekly basis, they really can use it offline. It also doesn't require iOS or Android systems that are the latest and greatest, so it makes access much easier. It's also very discreet. In a lot of communities, mental health conditions are stigmatized.
Yes.
And teens are afraid to confront. So, we have stories of we have, one particular story that began about a year or two ago when we were running our first trial, and there was an adolescent who was living with a single mom, and during the pandemic became extremely withdrawn, had a great relationship with the mother, and then became withdrawn in the room the whole time. And the mother happened to have seen our study online, our first study, enrolled him in the study, and just what we talked about earlier. He's like, oh, what I'm feeling could be depression,
Mm-hmm.
and I'm moving these tiles around, and it's starting to help me make sense of my own feelings right now, and now I see what's going on. And he went from, I don't know what's going on, I just want to be in my room and I don't want to talk to anybody right now, to actually going to his mom and saying, hey, I think I'm depressed, can you get me help? So it
Mm.
can overcome that stigma, but that is an issue. We know that in a lot of communities, when we talk about the statistics about depression and suicidality, I mean, these are general numbers, but multiply it by 3 to 5 times. And those are the LGBTQ communities. Those are the BIPOC communities, they're, non-white communities. So it's even worse. Part of it is because there isn't enough screening.
Mhm.
We really need to be screening more, and there's advocacy now to screen in the schools, as I'm sure you know. And then therapy is not available. Like, we
Mhm.
don't have
Right.
enough therapists.
Literally.
Yeah, and
Literally.
yeah, it's and although telehealth, it was a great solution, we're still lacking enough providers to even provide the telehealth. So you add the fact that not enough kids are being screened. They're not seeing their providers, even when they are being screened and identified. There's a stigma. It's not great for a kid who says, I can't go to practice today because I have to go see my therapist. There's
Mhm.
a lot. That's a lot,
Mhm. Mhm.
you know?
For an adolescent, especially recognizing how important their social status is with their
Right.
peers.
Yeah.
Absolutely. Dr. Alouf, this has been an amazing first segment, and we're at the point where we're getting ready to have our first break.
Okay.
And listeners, listen in. We are going to share Limbix commercial around Spark RX and how to access it. But we're going to continue this conversation, continuing to dig into understanding stigma, understanding digital therapeutics, and we want your questions. Feel free to call in, and if you're in our Facebook community, post those questions in the comments for Dr. Alouf, and we will try to get them answered when we come right back from this break. Awesome. We are clear. Hello, Lucy. Thank you so much for, Lucy says that she appreciates the fact that you include parents.
Yes.
Hello, Donna. Please share this conversation as you are logging in and listening. Share this conversation onto your page so that we get more of the message and the opportunity to connect young people to digital therapeutics, and recognizing how it can begin to really change and impact lives. Oh, so Lucy, I'll let them answer for a second, but we're gonna, literally, they're gonna tell me in my earbuds that we'll be back from commercial in a moment, but we'll let Dr. Alouf answer how long is Sparks RX intended to be used, long term, short term. So we will start with your question as soon as we come back from break. Oh, wow. Well, we got a whole minute. We have more than a minute. So first, I want to acknowledge Latoya. So Latoya has joined us, and she is an educator. So Latoya, I would love to hear your questions from the view of an educator. What would you like to understand about Spark RX as a resource for the families and the students that you serve, or those who are older and older grades? So think about your question. Latoya always comes up with great questions. Oh, wow. All righty. Yay, Lucy.
Yeah, that's great.
Fantastic. Latoya, also, if you can share it to your page so that we can get other educators aware of this conversation as well, that would be awesome. All right, we're coming back. Welcome back to Living Strong, the Flip Side of Adversity. We have been having a conversation about adolescent mental health. It's their journey and its connection to digital therapeutics and the opportunity to help them better understand their internal narrative, connect it to external connections and relationships, and become very strategic and intentional and empowered in their own healing journey. Just before we took our last break, Dr. Alouf was talking about the opportunity to use Spark RX for adolescents within marginalized or minority communities, recognizing it's an opportunity to gain better access. But we had a question from one of our listeners, and Lucy said, how long is Spark RX intended to be used? Is it long-term or short-term?
So right now, the way that it's designed is it's 5 levels. Each level it takes about a week to complete. But if teen is offered it by their provider, they get a total of 7 week access to it. We are working on other options. We're constantly refining and improving the product. We get feedback both from users, patients who use it, as well as providers. We're looking to see if certain components can be, last longer, or there can be a continuation. Because as we know, it's not a 10-day course of antibiotics and you're right. It's relapsing, remitting, and you want to go back to the resources that you may have achieved and may have learned and may have retained, but want to maybe do check up on it again. So we're looking at that opportunity as well.
I was curious because healing isn't a linear,
Right.
Nice, neat little process. So when they've gone through a particular level, they can actually go back and repeat that level again.
Yeah. So right now, the way it's designed, it's through a gated program. So you have to go step by step. So it starts off with a psychoeducational component, teaches you how mood affects behavior, and behavior affects mood, just like we were talking about. Has them identify behaviors and how different behaviors and how they affect their mood, and then at different levels teaches them how to go about and engage in activities and give them mastery in activities and give them agency. There's also a little wellness component, grounding exercises. There's a relapse prevention section at the end, so it's very structured, and it's designed to be as what you would get through a therapist. But again, we continue to refine it, because as with a therapist, you may skip around a little bit, right? And it's quite interesting. We have one of the nice things that providers like with using it is that we actually have about a quarter of our users are either counselors or psychologists. And what they like to do is to meet with their patients and say, okay, what level are you on and what module are you doing? Tell me about it. And it becomes integrated into the therapy, as opposed to having them go out and then come back and have to report something on paper or something like that. Here they can actually experience in a way what they may have done, and also see, because the app is feeding to them, which level and which module they're in. And so it's very integrative that way.
So we've been talking about we and they. So tell our listeners a little bit more about Limbix, who you are,
Sure.
and the organization as a whole.
Sure. So the company started. I've been there since July of 2021. Company started in 2016, first as a virtual reality company. The two founders, Ben and John, were making products with other wonderful people that are still with us here at the company now. That therapists were using virtual reality to simulate events for their patients in the office. So, in terms of for anxiety disorder or PTSD or something like that. So the therapist would sit with a tablet and simulate an activity, and then the patient would sit with the VR glasses in their office. And the therapist said, "This is great. It's super helpful, but what do I send a patient home with?" It's clunky.
Yes.
It's not convenient. It's not particular. I mean, it's portable, but it's not very portable. So they said they pivoted it, and they said, well, I believe it was around 2019. They said, well, how do we take what a therapist would do in their office and convert it into software, into a digital therapy? And they got together, I believe, with the Colorado Institute of Innovation, University of Colorado, and they basically translated psychotherapy, cognitive behavioral therapy into an integrative app. And they did we did a study, or they did a study, and it improved depressive symptoms in teens just as a standalone. Then they followed up with another study comparing it to a sham app. Both performed well, because, as we know, just telling a teen, right? I mean, there's a huge placebo effect in treatment of depression, especially in teens. But in the what we call the per protocol analysis, the app performed better than just telling a teen what depression is, and giving them resources. So prove that behavioral activation, that active ingredient delivered digitally, does make a difference.
Mm.
So.
So you shared initially one example of how awareness for a youth actually brought it full circle for him to come back to his mom, who he already had a good relationship with, to then continue to further his healing journey with seeing a physician. Are there any other stories that you can share with us on how the product has been impacting young people?
So actually, there was just so like I was saying, we do user research and we reach out to users and see how they're doing. And I just wrote down some notes. One that we just got this week, where a teen mentioned that they've learned or at least remembered something about how to manage their mental health in reporting to us. Their effect, use of the app. They said that they were feeling less anxious in the past few weeks than they had in the past several months. It's interesting. They say they can't say it was the app for certain that led to it, but they've definitely noticed themselves becoming more mindful on how to react to situation that cause them stress. And they think that it can be contributed to the app, and that's fine with me. I mean, for me to have a teen who is reacting to certain things that's not productive, it's not conducive to their own well-being, using our app and then coming back and saying, I'm doing things a little bit differently that are a little bit better for me personally. I'm not sure if it's the app or not. Okay. That's
Okay,
good.
yes.
That's okay. I'll take it.
That's good. And just the when you shared earlier, the young person going back to his mom and having the language to say, I think I'm depressed. There, when you shared that, there was a moment for me like, wow, that young person was empowered with language and awareness that he may not necessarily have received from his teens, or even how it may have turned on him and tried to dismiss it. And as young people are able to become more aware and empowered, there's such an opportunity for, whether they attribute it to the app or not, they're changing. They're changing. When I think about what's happening with our young people specifically. So I know that the show is global, but we are here just outside of Philadelphia, and a lot is happening with our adolescents and our youth. How would you say, as you think about what's going on with young people, how are teens in communities like Philadelphia being adversely affected by just the conditions of coming out of the pandemic and what they're struggling with?
Boy, yeah. I mean, it's emergency rooms are full with kids that are have suicidal ideation or suicide attempts. I'm not sure what the numbers are, at CHOP and so forth. I know University of Colorado Children's Hospital declared a state of emergency in May of 2021, saying they don't have beds for physical health patients because of all the behavioral health. They just republished, just recently saying nothing's changed. The resources just aren't there. It's devastating. I can imagine that the Children's Hospital here and as well as other hospitals are experiencing very similar things, and it is a global issue. It's not just in the U.S. So I'm glad that globally we're broadcasting, because they're experiencing the same thing. There's also an interest in these digital therapeutics. The 9% of teens, attempting suicide, that used to be the number of teens that were diagnosed with depression, 20, 30 years ago. So, and like I was saying earlier, we need to screen and we need to have resources for treatment. We need to identify, it's a lot of these successful suicides are also with handguns.
Mm-hmm. Yes.
Handguns are, are a somebody taking their own life. These suicides are with handguns, and that's a big issue, and it's a big issue
Mm-hmm.
in our community. I mean, 37% of, I was just reading the other day, 37% of handgun deaths are suicides.
Mm-hmm.
It's a very unfortunate lethal means. So we're experiencing that. Yeah, it's devastating. And that what brought me to Limbix in the first place is just I was working elsewhere. I was working for a health plan, and I saw what was going on, and now with my own family, peers, friends, and their kids, and I just felt like we need to do something.
Yes.
It's not, this isn't tenable, and it, like I said, a year ago we were declaring it an emergency, and nothing has changed a whole lot.
So I want to make sure at the top of the hour you shared that digital therapeutics are not like the wellness apps, and you've outlined some very specific ways that it can be used. But I want to make sure our listeners understand, what does Spark RX actually treat,
Mhm.
and who can actually use it?
Okay, great. So, like I said, we're not SparkRx it's not a cleared product. We are going through the process now, but it is available through the enforcement policy of the public health emergency. Providers sign up, and we've had people come up to me or email us info@limbix.com requesting information to bring to their providers. The provider simply signs up. We confirm that it's them. They get an access code, and then the provider can start offering it to their patients. And if they identify a child with depression in their office, they can have them download the app and give them because you need an access code to actually
Mm-hmm.
use it. You can't, just download it. And right now it's at no cost to the patient or the provider as we're working through that enforcement policy. We just want people to start using it.
Mm-hmm.
We believe it's a benefit. Our preliminary studies show that it is. And so that's why it's at no cost. So it's just a matter of providers signing up, getting an access code. They see a patient with depression, they have them download the app, they give them the access code, and the child, teen, adolescent can start using it. But most importantly, we want it to be to work together with what other therapy or other, whether it's through a school counselor, through their family physician or pediatrician, and certainly familial involvement and caregiver involvement is critical.
And what's the actual age range that the product is best for?
13 to 22.
Yeah,
That's our that's our age range for it. Yeah.
yeah. So I'm looking at Latoya's question, and she's an elementary school educator, and she says we're noticing more behaviors in children as young as 7 years old in our schools, and teachers are not equipped to handle the changes were occurring post pandemic. How can we share this information with staff so adults become more aware of ways to properly communicate supports for students and parents?
Yeah, the teachers. I mean, teachers are becoming mental health professionals, right? I mean,
Forced
it's
into it.
yeah,
Absolutely. In
yeah,
real time situations.
and God bless the educators out there, because I mean, they got their hands full.
Mm-hmm.
And like I was saying earlier, everybody thought everybody was going to go back to the classroom and learn math again.
Mm-hmm.
No, they're learning how to adjust. They're learning
Yes.
how to interact. They're learning how to participate and be with other kids. So how can we share this information with staff so adults become more aware of ways to properly communicate support for? I mean, there are support mechanisms out there. There are speakers that are willing to come out and speak. Dr. Jack, I know, does a lot of this, and these types of broadcasts are very important. And like I was saying, we do get call outs from school districts that are they're managing children's mental health. I don't know, what is the ratio in Philadelphia? One counselor for how many thousand
Oh,
students or
thousands of
something?
students.
Yeah.
Yes. Yes.
Like, how do you do that?
Right. With the magnitude of need, I just think about the amount of pain that young people are experiencing,
Mm-hmm.
and the experiences of trauma before the pandemic. And you actually spoke to it. As I coach and am working in schools, teachers have to wear so many hats beyond just curriculum, and being able to have conversations with educators, with counselors, with that there are resources that their children, their families can access, that can begin to lift the veil off of the stigma that comes along with mental health, because I love the gaming kind of aspect
Mm-hmm.
of the app itself. And Latoya asked a clarifying question.
Mm-hmm.
Is Spark RX a program used as an identifier of depression, or a preventative measure for depression, or a navigator through managing depression in a meaningful way?
That's a great question, because there are certain digitals that are diagnostic digitals,
Mm-hmm.
right? So this would be for, so again, we're not cleared yet, but, in terms of what we position ourselves at is, for the treatment of adolescents with symptoms of depression. So it would be more on the treatment side of that question, rather. It's not intended for diagnoses. It's meant once a patient has been diagnosed.
Gotcha.
Yeah.
Thank you. So, if we were in the ideal world, I'm wondering, what impact is Limbix hoping to have with this product? I know you're not cleared yet. You're still in the phases of work, but what's the ideal? What's the hope from all of this work?
To get kids treated where they're not getting treatment right now, to see, to bend the curve. I mean,
Mm-hmm.
it's not changing. The concept that once the pandemic is over and everybody's back together again and they're going to school and they're participating in Thanksgiving and Christmas and other activities, everything is going to be great again. It's just not happening. We'd love to see that we'd love to see part of the bend in that curve and see this emergency situation dissipate. We're also working on other products, and creating a pipeline next up for anxiety. But create products that are part of the armamentum for treating mental health. Because, I first started training back in the 90s.
Mm-hmm.
We had a shortage of primary care providers. We had a shortage of mental health providers, especially amongst teens and especially amongst the Medicaid, and then just had recently the CHIP population.
Mm-hmm.
And nothing's changed. It's and the truth is that healthcare providers are leaving the workforce. 300, I forget the number, but it's 1 out of 5. 20% of healthcare providers have left the workforce. 330,000, I believe, is the last count of providers that have left the workforce, and something like a fifth of those or a quarter of those are mental health providers.
Mm-hmm.
So we talk about building out the care providers and putting people more through training and building out the workforce, and that's great, but that's not happening tomorrow.
Right.
And these digital therapeutics are infinitely scalable. Whether you're giving it to 10 kids or 100 or 1,000, you're good. But if you have to provide direct face-to-face mental health to 10 versus 100 versus 1,000 kids, like, you need X number of mental health providers added on. And as you know, because you've gone through a lot of education, it's expensive
Mm-hmm.
and it's time consuming. So, this is a way to do it more instantly and more in a more timely fashion.
Yeah. And as you talk about it being scalable, I continue to think about our earlier comments and reflections on how communities that are under resourced have an opportunity to not only address the potential stigma because of the private nature of an app. I mean, how many people do you see looking at their phones? It becomes very private but intentional for the person.
Mhm.
But it also allows an opportunity for communities that do not physically have quality mental health providers anywhere near them to begin to have access to quality resources through your products. Powerful.
Yeah, I mean the average waiting time is what, 4 to 6 months.
Yes.
We've spoken to a large hospital organization where they have 800 kids on a waiting list. I mean, that's how do you do that? We've spoken to folks in other states where it's up to 12 months. In rural communities, there's no access. It's not just psychiatrists, it's psychologists, it's counselors, it's other mental health workers. So if you're diagnosed with depression in an office, and you get a referral to go see a therapist, and you have to wait 4 to 6 months. I mean, that's way too long. At least you can get started on something that is therapeutic.
Mm-hmm.
It may help you.
Mm-hmm. Mm-hmm. And I think about well, first of all, the amount of courage it takes to make the decision that I need help and I'm going to pursue it, and then to be told, well, you have to wait 4 months, then I've lost the courage after 4 months, and how realistic will it be that I actually follow up? And going back to something you also shared, because I was having this conversation earlier within the early childhood programming, within K to 12 programming, now physicians, there are professionals who are just completely leaving their fields. And a part of the conversation I was having earlier is almost that endless, the feeling of this is endless, and like, what am I doing? And that weight of not actually feeling like this is making a difference. And as you described at the top of the hour, how parents can be informed, young person can be informed, but also on the end of that, physicians can actually begin to track as well the impact of their decisions, of how they're actually helping young people. So we have about 3 minutes left.
Okay.
I want to make sure people know how to follow you, how to follow Limbix. So
Sure.
what are your social media handles, and how can they find you?
So the company is Limbix, limbix.com. SparkRx, SPARKRX.com is the product. I'm on LinkedIn. We can if we can post the social media handles for. I know we're on Twitter, and I know we're
Yes.
on Instagram. I'm sure if you look up Limbix, you'll find us. And it's great. We have a good following. We want to provide people with education. We have webinars. We go to Capitol Hill to advocate for mental health in teens and access to mental health in teens. We participate in conferences and exhibits with providers. We really want to bring this. It's new. There are a lot of questions, but we love to talk about it. We love to educate folks about it. There's a lot to learn, but I tell people in the next few years, and hopefully not too long, this will be a standard of care. You'll go home and you'll get a digital therapeutics to help you guide through your treatment journey. And honestly, it's not just mental health. Whether you have eczema or asthma or diabetes or depression or anxiety, part of your treatment will be to have something digital on your phone to help you carry through that treatment.
The accountability and support. Dr. Alouf, thank you so much
You're welcome.
for
This
this
is great.
conversation. It has been meaty, and I encourage you to share this conversation with someone. There are so many families who have young people in need, and there's an opportunity for awareness, information, and access to a product that is making an impact, and watching the work that they're doing as they move through their Is it certifications? Is it actually getting through the FDA process? So thank you, Dr. Alouf. Thank you for listening into another flip side of Adversity Conversation. Same time, same place next week, right here on the flip side. We'll see you then.
Thank you, Latoya.
Thank you, Josh. Awesome. Latoya, this is an ingenious idea and powerful potential product. So many families need access to this. Absolutely. So share. Share Latoya, share it with your educators. And Facebook community, thank you for showing up. Continue to push this out. We want to be able to get this conversation far and wide. So share the replay with others. Lucy asks, I'm just curious, because of social media platforms and where young people get their news and information, is there any truth to mental health issues as a trend?
Well, I mean, so, we know that from reports from the federal government, there is, worsening of mental health conditions amongst adolescents and teens, particularly accelerated during the pandemic. So I don't know if that specifically answers the question. I know that people question whether social media is causing it, or, and that's a whole other issue, and it's very interesting. I read a lot about that. Because we have to sort of distinguish ourselves. No, we're not just
Right.
we're not another social media platform,
Mm-hmm.
right? We're it's actually very interesting, from what I've been reading and learning to understand. In a lot of respects, social media may be contributing to it, but in some respects, it also if it's a safe space and if it's a good community engagement, it allows teens to maybe understand their situation better when they see other people experiencing similar things and reporting on it. So I think from what I'm reading about it, it seems to work both ways.
Okay.
For some teens, it's okay, this is what's happening with me, and I see this other community that I'm engaging with, so through social media, that is feeling the same way. On the other hand, sometimes it doesn't work out quite as well, and it doesn't work out that way. And so, I think there's a lot for us to learn there and to know more about.
And I think about just developmentally how adolescents are trying to find themselves by watching other people, and how the illusion of social media can throw people off, young people specifically, on truth, and really actually recognize that it took 45 shots for that one picture to end up on Instagram. Like, that's
Right.
not their real
Right.
truth. And young people, because developmentally they're still trying to figure out everything, they depend on and often compare themselves to others, and what they're not. But I also think, as you were talking at the top of the hour, you talked about the internal and the external narrative. And so if I have an internal narrative that is distorted, and I'm watching things on social media that can feed that internal narrative that's distorted, and I don't have any external connections that are providing me with a different truth or relationship, it's almost like this quiet storm for disaster. So I also think about, we want to hang all of the woes on social media when it's actually not just
Right.
social media.
Yeah, I mean, that's a great point, because what we're seeing is kids who may have a certain feeling, and again, they don't want to engage with the outside world. They're not comfortable, either because of stigma or for whatever reason, don't want to engage with somebody who can appropriately direct them. They may not even have somebody in their life that can,
That's
right?
it. Yep.
So they see a 30-second loop on social media. It's very engaging. It's, really makes you feel great. And you're like, oh, must be what I have. And then they're almost starting, I was just reading today about a lot of self-diagnosis amongst teens and adolescents. So, where's that line drawn, right? Where is it that they see something on social media and it makes them inquisitive, and then they go to reliable sources? And where where is it that they get, sucked into that rabbit hole?
Spiral and
Yeah.
spiral.
Yeah.
Yeah. Wow. Facebook community, I appreciate this conversation. Thank you for taking the time out. We will continue to push out the commercial. Now, the key thing, Facebook community, share the link to the Voice America episode, because we have a Limbix commercial that is also playing. So we want to be able to support the community of within the organization and continue to push out the message about the powerful work that they are doing. As always, thank you, Facebook community. Always appreciate your support. And right here, same time next week, we'll see you then. Awesome.
Want to end your broadcast?